This biosafety training provides health and safety information to anyone handling biological materials and to ensure compliance with regulations. These best practices will help protect you, the community, and the environment. A biosafety training is required initially at hire and annually after that. It is for those that handle materials that are potentially infectious to humans, plants, or animals, which include human-derived materials such as blood, tissues, cell lines, or recombinant and synthetic nucleic acid molecules. In addition to training, all biological research at the university must be approved by the Institutional Biosafety Committee. Risk assessments identify and determine the hazards and containment levels for infectious materials. Risk assessments provide a guide for safe work practices, safety equipment, and facility design.
There are 4 risk groups in biological hazard classification. Risk Group 1 is the least dangerous, and Risk Group 4 is the most dangerous to healthy adults. Individuals who are pregnant or immune compromised should seek medical advice before working with biohazards. To determine the risk group for your work, please see the CDC publication, Biosafety in Microbiological and Biomedical Laboratories. Risk Group 1 agents have a low personal or community risk. Examples include E. coli K12, Lactobacillus acidophilus, and Saccharomyces. Risk Group 2 agents are associated with human diseases, which are rarely severe and have available treatments. Examples include Staphylococcus aureus, Streptococcus pneumoniae, and Salmonella. Risk Group 3 agents are associated with severe or lethal diseases for which treatments may be available. Examples include SARS-CoV-2, Mycobacterium tuberculosis, and Yersinia pestis. Risk Group 4 agents are likely to cause severe or lethal disease for which treatment is not usually available. Examples include Ebola virus, variola virus, and the monkey bee virus.
To manage the 4 hazard levels, there are 4 containment levels. All risks are assigned a biosafety level for work involving the biohazard. Each biosafety level, or BSL, has requirements for facility construction, laboratory practices, and safety equipment. There are 4 biosafety levels assigned for containment and protection. These are sometimes different than risk groups. Biosafety Level 1 is assigned for minimally hazardous agents. Examples of equipment found in a BSL-1 facility are benchtops, non-porous chairs, and hand-washing sinks. Carpets and rugs are not permitted. When working in laboratories, closed-toed shoes and appropriate clothing covering the legs, arms, and torso are required. Securely fasten any long hair, loose clothing, or dangling accessories. Long nails are not permitted. Lab coat, gloves, and eye protection are required in a BSL-1 facility.
BSL-2 is assigned for agents associated with human disease and pose moderate hazards. Examples of equipment found in a BSL-2 facility are a biological safety cabinet, an eye wash station, self-closing and locking doors, vacuum line filtration, and all BSL-1 equipment. A method to decontaminate waste, such as a steam autoclave, must be available. Lab coats, gloves, and eye protection are required in BSL-2 facilities. Additional PPE and respiratory protection may be required as determined by risk assessment.
BSL-3 is assigned for work with infectious agents, which could be inhaled and are associated with serious or lethal disease. Examples of features in a BSL-3 facility are sealed floors, walls, ceilings, hands-free sink and ventilation with directional airflow, and BSL-1 and BSL-2 equipment.
Lab coats, gowns or suits, gloves, and eye protection are required in BSL-3 facilities. Respiratory protection is considered depending on the agents. BSL-4 is assigned for dangerous and exotic agents associated with life-threatening and frequently fatal disease. There is high individual risk of aerosol-transmitted laboratory infections, and there are no vaccines or treatments available. Work with agents with unknown risk of transmission but known relation to a BSL-4 agent are conducted at this level until sufficient data is obtained to redesignate the level. There is not a BSL-4 facility on campus. To receive credit for this training, complete the test with a score of at least 80%. For questions or assistance, contact EHS.
Contact Environmental Health and Safety for more information about biosafety levels, containment, and risk groups.